So we're going to do chair massage, and we're just setting up the chair. The seat is angled, so she's going to be leaning forwards. The breastplate, the rest cushion, needs to be just really comfortable for her to lean against. Sometimes, depending on how long the torso is, you might need to adjust that. You don't want their chin resting on the bar here, so you need to make sure that as you look through, her head is nice and easy around the face ring, so she's not feeling squashed, she's not being able to breathe because everything's in her way and there's nothing restricting her throat. So just check those little things out, make sure she's comfortable. How are you feeling? Very comfortable, thank you. Good. And just be aware that when you start to work on people, they slump a little bit more in this chair. They'll relax their shoulders because that's what you're doing. So it might need adjustment as you go along. Might need adjustment here, might need adjustment on the armrest. Or then you might need to get somebody to sit up and actually move forward again into position because they just let go so much. Okay? All right. So we've got, I think, first contact. Okay. Your body use is the same as if you're working on a couch, but now, as you see, I have 360 degrees of access to my client, which is just a joy, okay? But the initial contact is the same as you would on a couch. So you're going to bring your hands slowly to rest. My hands are a little cold, I apologise. And these first moments are the same as if they're on the couch. It's time for you and for them to connect, to relax. So I'm checking out my own body, maybe taking another deep breath, letting myself relax. I can feel Karen do exactly the same thing. I'm doing nothing yet. I have slight squeeze on that upper trapezius, do I not, Karen? Mm-hmm. Okay. So that's just a slight squeeze on the shoulders there. And I might use just pressure coming down. Where's the pressure coming from? From my body weight, from the torso. From where am I leaning from?
Your legs.
Yeah, absolutely. So I'm just getting into a good position. Remember, it's like pushing a car. Good position, 1 foot forward where I'm going, 1 foot slightly angled at the back, and all I'm doing is leaning in as if I'm going to push a car. That's it. That's all you're doing. And I can do that all the way down. Now I might need to adjust my position as I go down. Good. So it's like a little wriggle as you go down.
It's like doing a stretch, isn't it?
It's a lovely stretch. So that's flat hands. I'm using the heels of my hands to just literally press either side of this. That position there would not be too good on my hands if I do too much of it. Can you see why? Yeah, my wrists are really quite flexed there. So I'm not going to want to do too much of that technique. So there's different ways. I might want to use the squeezing technique. Now I'm just using a slight squeeze between the heels of my hands and the fingers. You can come right in, Gavin. Have a look at that. But when I get to here, I don't want my hands to be so flexed. So I can use fists. Okay? I can just do straight fists like this. Coming down the spine. And the pressure is equal, sustained, gradual. So if you watch again, if I put my hands here, my fists here, I'm going to get in position, I'm going to lean in, I'm going to notice how much resistance there is in her body. Lean, 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 and come out just as slowly. Okay? And I can move my hands to that position if it's more comfortable in certain areas. That way there's no strain on my wrist, so I really wouldn't do an awful lot of this. I might do it up here. But by the time I get to around about T10 on the thoracic spine, I'm actually going to be changing that to fists. Down this way. You can do this fast as well. And there's a little twist for you. I like little twists when I work. So if you watch that twist, I'm twisting from medially laterally with my fists. It's a lateral twist. Or here, when I'm straight here, I'm going to twist the other way. So I'm actually just using the little fingers there to just twist out.
So you don't use any pressure on your thumb?
No, there's no pressure. So that little twist movement you're going to like, I think.
It feels really nice.
Okay. Now I just need to see what I said I'd do next. Okay, squeezing. Hands connecting, pressure strokes. Palming, fist, knuckles, and then with a twist. The other way, of course, because you've got 360 degrees, there's nothing to stop you starting here. Making the connection. And then what I can do, it's a bit like when they're on the couch, I can actually use my body weight to stretch down on the shoulders. And I might spend a fair amount of time just allowing that stretch to happen. No need to rush that. Just allowing her body to there. She's just let go beautifully. Did you see that? Did you notice that? So let's go the other side. Yeah, she just let go again. Beautifully. Okay? So very often it's not how fast you do it, it's actually the quality. So again, squeezing, and all I'm doing there is just shaking her. That's just a habit of mine. Okay? Just showing you my habits. Okay, we're going on now to using the forearms. You okay with all that so far? Mm-hmm. So follow with your pictures. So you all know with forearm use that you're going to use mostly that nice fleshy area on the wrist flexor area. So if I flex here, we're just using this area here. And you're going to keep your hands and wrists nice and relaxed. No need for those to be in any fists or anything like that. Nice and relaxed, okay? So where might I place my forearm and do some nice forearm work? This is just using pressure, yeah, shoulders. So I could use it as a lever and just lean in here. Yeah, she's just let go again, nicely. Thank you, Karen, you're great at letting go. And I can use that same forearm really pretty much all the way down. Again, notice how you just adjust your body use, so you just make more and more of a... It's getting less easy for me, so I might move the arm so it's more angled down. That's less comfortable. I'm going to stop there. So I can use it that way and go alongside the spine. I'm between the scapula and the spine there, so there's nothing on the scapula there. I can rest my hand on her or on me, depending on what I want to do. Or I could flip around and use the other forearm. Quite useful, isn't it? Forearms are very useful. Again, it's nice and soft, nice and relaxed. Same here, I can use my right arm, and I can, if you're used to using your forearm, I don't know how much you've all had experience of that, then you can use your forearm more directly into those muscles. I don't mind, it depends on what you're comfortable with. So I'll show you the possibilities of that. So I might roll my forearm onto that upper trapezius area. How are you doing with that?
Just so lucky, Karen.
Okay.
You can feel the pressure much more direct when you come from that way.
Yeah, it's
You
just
get
getting
your
into
body
your
round,
upper trapezius, isn't it?
Yeah.
But if I want to get into those areas in between, see if I use more of an elbow. Yeah, okay. So if you're used to using your forearms, then great, use them well. Okay. One of the things, so lots of squeezing techniques are very useful. What I'm using here, everybody used to using the supported thumb technique. Come really close so you can see what I'm going to do. I'm going to place the thumb where, see, I've felt some tension in there. I'm going to use the other hand on top, and so the pressure for that, so it's actually like that. So where it's tight, the pressure is coming from the left hand, not from the thumb. So the thumb is just being used as a tool. Yeah, good. And I use that a lot if I have any areas like that. Or I might just use a squeeze. Any kind of squeeze, hold, shake movement. And there's a particular squeeze which I like, which is to link fingers like this and just squeeze into areas like that. Works really well on the arms and on the upper back. It depends on the person, okay? What else is on your sheets now? So, pressure, going down that way, going down that way. Doesn't really matter as long as you are doing it with awareness. And the other way you can use your forearms is literally with both. And here I'm just going to lean down. And again I can just go off to the right and the right. Yeah, I'm going to do that next. Okay. So really a lot of this is just pressure so far. And then your Petrissage movements. Anything Petrissage you can use, but it's going to be more the picking up and squeezing. You haven't got so much of the option of scooping. It's not going to work so well. So it's more squeezing, shaking, and the oscillation techniques. So remember those lovely vibration techniques? Remember, vibration is holding your hand on and shaking the tissues. So you need to make good contact, and then you're going to actually shake the tissues underneath. And you can go anywhere with that. And I might do it more specifically. That's using the heel of the hand. I might use, see there's some nice stuff in here that Karen's brought with her for us. So I will do quite a lot of that kind of technique. And I'm going to just go in there. You all know about compression, so I could use my supported thumb and do some compression work in there. That's right on the medial scapular border there, okay? How's that feeling? Good. So we can do some trigger point work in there if you're used to doing that.
So you know how you're using your fingers? Is the idea that you shouldn't really do that with your thumbs?
I'm not going to do a lot of that kind of stuff
No.
with my thumbs.
It's not good for
I
you.
would just more likely to use knuckles.
Yeah.
That's
I see.
what I
Okay.
mostly would use.
It's quite nice.
Fingers together. If I'm going to use the thumb, that
Like a
doesn't
compression.
really work as well for me.
Mhm.
So I'm probably going to use knuckles.
Okay.
I'm going to use anything that doesn't injure me.
Okay.
I'm not interested in injuring me. So vibration. Knuckles I use a lot. All the time.
Because it's easier.
It's just easier. Yeah, if you're doing a fast vibration in a small area, it just makes sense to me.
Very
It's
less
not
pokey
risky.
as well.
It's less pokey. It's less pokey, yeah. What else is on there for the first time? Rocking. All right. I've done most of it apart from the rocking. Okay, how many of you done rocking? You are going to love it in a chair, okay? Because look at how mobile the spine is with the slightest touch. Look at how easily that moves. So, if you're not used to rocking, I would keep your hands on to start with. Keep your hands on and just feel the rhythm of the person. Don't impose your own, just feel the rhythm of that person that you're working with along the spine. If you're more used to rocking, you can start to play with it. You can play with it a lot. So if you're really used to rocking and oscillations, you can start to work the shoulders and the spine at the same time. But wherever you're at is fine. So if you can just do that, that's lovely. And remember, all of the contraindications apply. There's no difference once you've got somebody in a chair. In fact, it's more important sometimes in a chair. I want you to look at how mobile that spine becomes in a chair. So if you've got somebody with lower back instability, you have to be very careful what you're doing. Okay. So that kind of rocking you can do in all sorts of dimensions. So I'm going to go this way, I'm going to go. I can use my forearm. Okay. In those ways. And I'm just kind of checking how easy everything moves. Okay, so we'll see how you do with the rocking and see where we can take that. For sure, very often I'm pressing on this area. If anyone done rhythm mobility with Darian? No? Okay. One of the things with rhythm mobility is to combine techniques. So here I'm pressing here and rocking here and just using it to mobilise the whole body. It's not difficult, but it's a process. You need to get used to just the feel of people's bodies moving. And then once you've got the feel of people's bodies moving, then you can begin to bring in other things, and it gets very exciting at that point. Okay, any questions? So that's quite a few things. That's lots of kind of... Do you see how I've put in more pressure stuff instead of the effleurage? More squeezing instead of some of your Petrissage movements. You've still got all the compression available to you. Forearms works really well because the angles, yeah. And however you want to finish a treatment, however you finish your, you do quite a lot of stroking the spine. All of your percussion strokes, all of your percussion are still valid in this position. Okay, so however you want to finish a treatment is entirely up to you. What I would say is that when you have finished a treatment, coming down to giving them a sense of their feet is important, however you want to do that. It might be when they get up, you need to be careful how they get up. But a lot of the tension is in the upper body, so actually very often what I'll do is bring their attention back down to their feet. Okay, just so they know, just before they're going to get up, there's their feet, tension's back down there, it's not all up in their upper body. And be very careful how they get up off the couch. They're often a bit, just come back from you. There. Now, what you may notice there is that I just helped with the shoulder there. It does stop people leaning on the headrest as they come back. So if you just kind of just give them the indication, they can come back quite easily. All right? You all right? Good. How's that feel? Seam? Good?